very wicked illness that is also stubborn as hell. Its name is cancer. And many people have had someone they know suffer it. Maybe a family member or a friend or a neighbor who was fine, but all of a sudden fell ill and died faster than anyone expected. And when it happened, the conversations around it were one of two things. Either too clinical and confusing, or it was wrapped in fear and silence. And sometimes something spiritual was suspected. Maybe it was an attack. But what all of these are not is clear. Today, we are going to gain clarity on what cancer is, what it is at the level of the cells of the body, and why Nigerians specifically have a problem with diagnosing it late. We'll talk about the 4 cancers that are most likely to affect a Nigerian. We'll highlight what to look for and what you can do today that could change an outcome years from now. This episode is not meant to frighten you. We'll just see what is useful to know and understand the concept of cancer. And once you understand what cancer actually is, it stops being an abstract terror and becomes a specific, manageable, and in some cases, preventable thing that you can do something about. I am Angelo, and this is the Clarity Podcast. Let's talk about cancer. And to start from the very beginning, the word cancer is often used as if it describes just one thing. It doesn't do this exactly. Cancer is actually a category of over 100 different diseases, but they are grouped together because they share one essential feature, and understanding what that feature is explains almost everything else. So, your body is made up of trillions of cells, and each cell has a life cycle. It is born, it grows, it does the job, and eventually it dies and is replaced by a new cell. Now, this cycle of life of a cell is tightly controlled. Your DNA, that is the genetic instruction manual inside every cell, contains specific codes that tell each cell when to divide, when to stop dividing, and when to die. Now, when these instructions work correctly, everything in the body runs in order. But cancer begins when these instructions break down. So, when something damages or changes the DNA in a single cell, this change is called a mutation. The mutated cell now ignores the normal signals that tell it when to stop dividing. It divides rapidly and continuously. And unlike normal cells, it does not die on schedule. It just keeps reproducing. 1 abnormal cell becomes 2, 2 becomes 4, 4 becomes 8, and over time, this uncontrolled mass of abnormal cells become what we call a tumor. Now, there is a distinction in the types of tumors. There's a benign tumor which grows only in one place. It does not invade the tissue surrounding it, and it does not spread to other parts of the body. It can still cause problems if it grows large enough to press on something important, but it stays where it is. And then there is the malignant tumor, which is cancer itself. Malignant tumors invade the surrounding tissue, and more critically, they can shed cells into the bloodstream or the lymphatic system. The lymphatic system is the body's network of blood vessels and nodes that helps it fight infection. Now, those shed cells travel to the organs and start new tumors there. And this process of moving to other parts of the body is called metastasis. And it is the reason cancer is life-threatening in most cases. A cancer that has spread from the breast to the liver or the lungs or the brain is a fundamentally different challenge to treat than one that has just stayed in one place. So this is basically what cancer is. Cells that lost the ability to follow the instructions of your DNA, and they are growing without control, and in malignant cases, spreading to other parts of the body. Now, before I talk about what causes cancer, I'd like to address some of the misconceptions that have come to be associated with cancer as Nigerians. First of all, cancer is not caused by any spiritual attack. I know the religious people will fight me on this, but the science of it is just obvious. Also, it is not contagious. So you cannot catch it from a person who has it. So these things are simply rumors. And they are beliefs that can cause real harm because people tend to seek spiritual intervention instead of going for medical investigations. And this can cost time. And time is not something you want to lose when you're battling cancer. So, what actually causes cancer? The direct cause is what is known as DNA mutation. Something damages the genetic instruction code in a cell, and the cell loses its ability to regulate its own growth. So, what exactly causes the mutation? And this varies, and it is where the risk factors that can predispose you to cancer come in. The first is inherited mutations. And some mutations are inherited from your parents. So basically, you are born with them. The most well-known example is the BRCA gene mutation. It's a specific change in genes that significantly increases the risk of breast and ovarian cancer in women. If a mutation runs in your family, your risk of having cancer is higher. And this does not mean that you will definitely develop cancer. It just means that your risk is higher. So it does not guarantee the disease. But it is important to know your family history and to discuss it with your doctor. Now, there is what is known as acquired mutations. And the majority of cancers are caused by mutations that develop during a person's lifetime. So these are not inherited. They develop because of exposure to something that damages DNA or simply because of random copying errors as cells divide over a long lifetime. And the main documented causes of acquired mutations include things like tobacco use. Tobacco use is the single largest preventable cause of cancer globally. Tobacco damages DNA in virtually every tissue it contacts and is linked to cancers of the lung, mouth, throat, esophagus, bladder, and more. Also causing acquired mutation is viral and bacterial infections. And this one is most prevalent to Nigerians. The human papilloma virus, which is also known as HPV, causes virtually all cervical cancer. Then there is hepatitis B and C viruses, which cause most liver cancer. Now, if you're listening to this episode, take it as a sign to go get vaccinated for hepatitis. Then there is the bacterium Helicobacter pylori, which causes stomach cancer. And these infections are common in Nigeria, and they are either preventable or with vaccines or treatable when caught. Other things that can predispose you to acquired mutations include excessive alcohol use, obesity and physical inactivity, prolonged exposure to harmful radiation, including too much of sunlight. Then there are certain chemicals and environmental pollutants. And in a significant portion of cases, simply the accumulation of random DNA copying errors over a long life can cause acquired mutation. And this is why the risk of cancer increases with age. Not because age in itself causes cancer, but because the longer cells have been dividing, the more opportunities there are for errors to accumulate. Now, there are specific cancers Nigerians should be aware of, because the cancer risk profile in Nigeria has particular patterns. And these 4 cancers account for the largest burden of cancer illness and death in Nigeria right now. The first one is breast cancer. And breast cancer is the most common cancer in Nigerian women, and it's the leading cause of cancer death in Nigeria overall. Breast cancer begins in the cells of the breast tissue. You notice a lump in the breast or armpit. This is the most common sign. But other warning signs include changes in the shape or size of the breast, dimpling of the skin, nipple discharge that is not breast milk, or nipple that turns inward. Now, although not every breast lump is cancer, many lumps are actually just benign. But every lump you notice deserves medical investigation. So the only way to know for sure is to check. So women are advised to perform a breast self-examination every month. And the best time to do this is a few days after your period ends, when the breasts are less tender. You use your fingers to feel the entire breast in a circular pattern. Also feel under the armpits and note any changes. And if you find something you're not sure about, please go see a doctor. Now, the second cancer is cervical cancer. Cervical cancer is the second most common cause of cancer deaths among women in Nigeria. It affects the cervix, that is the lower part of the womb that connects to the vagina. Cervical cancer is almost entirely preventable. It is usually caused by the human papilloma virus, which is a very common virus that is transmitted through sexual contact. Most HPV infections clear on their own, but in some cases, certain strains of HPV persist, and over years, they can cause normal cervical cells to become abnormal and eventually cancerous. So, some of the warning signs of cervical cancer include abnormal vaginal bleeding, bleeding between periods or after sex or after menopause. There is also unusual vaginal discharge and pelvic pain. So, one of the most important things to know about cervical cancer is the HPV vaccine. Now, this vaccine does not treat existing HPV infection, but it does prevent human papilloma virus infection in the first place. If you have daughters between the ages of 9 and 14, please get them vaccinated. Secondly, there is regular cervical screening. A simple test called a pap smear can detect abnormal cervical cells before they become cancer. And this test is available at every laboratory and Nigerian hospital, and it is not expensive. Now, the third cancer is prostate cancer. And prostate cancer is the most common cancer in Nigerian men. The prostate is a small gland below the bladder in men that produces fluid for semen. So prostate cancer often grows slowly, which is both its advantage and also makes it more dangerous because it can exist for years without any obvious symptoms, and which is why it is so frequently caught late. And warning signs of prostate cancer include difficulty urinating, weak or interrupted urine flow, blood in the urine or semen, pain in the lower back, hips or pelvis, also discomfort in the pelvic area. But the truth is, some men have prostate cancer for years with none of these symptoms showing up. So, what can you do as a man? Once you are 40 years old, it's advisable to have a conversation with your doctor about a PSA test, which is a simple blood test that measures a protein produced by the prostate. Now, raised PSA level does not automatically mean cancer, but it does flag a situation that needs further investigation. Now, the fourth cancer is liver cancer. And liver cancer is the third most common cancer in Nigerian men and a significant cause of cancer death across the population. And its primary cause is preventable. The majority of liver cancer in Nigeria is caused by chronic infection with hepatitis B or hepatitis C viruses. And these viruses cause long-term inflammation of the liver, which over the years can lead to cirrhosis, which is the scarring of the liver, and eventually liver cancer. Nigeria has a high burden of hepatitis B infection. Much of it is transmitted at birth from mother to child or in early childhood. Now, warning signs of liver cancer include persistent pain or discomfort in the upper right side of the abdomen, swelling of the abdomen, unexplained weight loss, loss of appetite, yellowing of the skin and eyes, which is also known as jaundice, and unexplained fatigue. So, what can you do? You know your hepatitis B status. A simple blood test tells you whether you are infected with the virus. And if you are not infected, you go and take your hepatitis B vaccine. And if perchance you have been infected already with the virus, you go for regular monitoring by a doctor so that you can catch any liver complications while it's still early. Now, talking about the Nigerian specific problem that makes all of these listed cancers more dangerous than it needs to be, studies have shown that majority of Nigerian breast cancer patients presented at stage 3 or stage 4. So basically at the advanced stages of the cancer, the stages where the cancer has already spread significantly from its origin. And for cervical cancer, a 2025 study from a Lagos tertiary hospital found that 56% of women diagnosed with cervical cancer presented with late-stage disease, and women with no formal education had over 4 times the odds of late-stage diagnosis compared to educated women. Now, why does the stage of diagnosis matter so much? Because cancer at stage 1 or stage 2 is largely confined. It has not spread far to other organs. Treatment is more straightforward and more likely to succeed. But when it gets to stage 3 and stage 4 cancer, the cancer has really spread to the lymph nodes and other organs or throughout the body, and it is significantly harder to treat. The survival rates are dramatically different. For stage 1 breast cancer, in settings with adequate treatment, it has a 5-year survival rate above 90%. The same cancer at stage 4 has a 5-year survival rate below 30%. So the timing of detection changes everything. So why is cancer often diagnosed late in Nigeria? Research identifies a consistent set of reasons. Reasons like the lack of awareness about early warning signs. Many Nigerians have never been told what to look for or why looking matters. And there is also financial barriers. The cost of screening and the cost of treatment are quite high for many households. Then there is also limited screening infrastructure outside major cities. And then there is also cultural patterns of seeking spiritual intervention before or instead of medical investigations. Then there is also the stigma and secrecy around cancer that prevents people from discussing symptoms until those symptoms have become impossible to ignore. Now let me briefly talk about the 4 ways cancer can be treated. The first is surgery. Surgery is the physical removal of the tumor and surrounding tissue. For many cancers that are caught early, that is when the tumor is localized and has not spread, surgery alone can be curative. The earlier the cancer, the more surgical options are available and the less aggressive the surgery needs to be. Then there is radiation therapy, which uses high energy rays, similar to X-rays but more powerful, to destroy cancer cells or shrink tumors. It can be used before surgery to reduce the tumor size or after surgery to kill off any remaining cancer cells, or even as the primary treatment when surgery is not appropriate. And there is also chemotherapy, which uses powerful drugs to kill rapidly dividing cells throughout the body. Now, this is why chemotherapy can cause side effects like hair loss and nausea, because rapidly dividing normal cells like hair follicles and the lining of the gut are also affected by the drugs alongside the cancer cells. So chemotherapy is a systemic treatment, meaning that it works throughout the whole body, which makes it particularly useful when cancer has spread beyond a single location. Then there is also immunotherapy, which is a newer and increasingly important category that works by helping the body's own immune system recognize and attack cancer cells. It has transformed survival outcomes for several cancer types in countries where it is accessible, although access in Nigeria remains limited due to its cost. But globally, it is a good direction for cancer medicine. Now, I would like to close this episode with some of the actionable takeaways from this episode. The first is, know your hepatitis B status. And if you do not know, get tested. If you are not vaccinated, get vaccinated. This is prevention of liver cancer. It is a simple blood test and a vaccine that are available to you and can save your life. Also, if you have daughters or sisters or family or friend between the age of 9 and 14, ask your doctor or a healthcare provider about the HPV vaccine. This is the prevention of cervical cancer. Then there is learning how to perform a breast self-examination as a woman. If you feel something you're not sure about, see a doctor. If you're a man above 40, have a conversation with your doctor about a PSA test for prostate cancer. It's a simple blood test and it could save your life. And regardless of your age or gender, if you have a symptom that has presented for more than 2 weeks and does not have an obvious explanation, please go see a doctor. Symptoms like a lump you feel on any part of your body, a cough that simply will not go away, unusual bleeding, persistent pain. These are not symptoms to simply pray about and see if they go away. These are things to investigate. Prayer and medicine are not mutually exclusive, but see a doctor first, consult medicine first, then pray. And finally, talk about it. Involve your family and your friends. The secrecy around cancer in Nigerian culture is costing a lot of life. Someone you know is probably sitting with a symptom they have told nobody about, and because they are afraid of the conversation or the stigma. Cancer is not a death sentence. It is not a mystery, and it is definitely not a spiritual verdict on a person's life. It's a category of illness in which cells lose the ability to regulate their own growth, and the malignant form spreads to other parts of the body. It has known causes, known warning signs, and dramatically better outcomes when caught early. Nigeria loses over 79,000 people to cancer every year. Many of these deaths happen not because cancer was untreatable, but because it was found too late. The stage at diagnosis changes everything, and the stage at diagnosis is something that awareness, screening, and honest conversation can change. This is The Clarity. This has been The Clarity Podcast. I am Angelo, and in this episode told you something you did not know before, or reminded you of something you've been putting off. Please act on it and share it. You can send us email suggestions on topic you would like us to cover on the podcast, and follow us on X for further breakdown of episode topics. See you next week, and until then, think clearly.